There are two things that you need to know. One, the definition of coronary artery disease. What is it? It is a narrowing of the arteries that supply blood to the heart. CAD, coronary artery disease. I mean, you can get fancy, but that's pretty much what it is in a nutshell. Coronary artery disease. Let me find another. Narrowing of arteries that supply the blood to the heart. You can see how coronary artery disease can actually can cause a heart attack, though, because I mean, if there's a narrowing of the arteries that supply the blood to the heart, it gets narrow. What is a heart attack? AKA the next one, which is myocardial infarction, a heart attack. What is an MI? A myocardial infarction, an infarct, is what happens when the blood supply is cut off and that muscle tissue dies. It's muscle tissue death in response to that blood flow being cut off. I'm looking up the definition so I can be technical. Myocardial infarction, commonly known as heart attack, occurs when blood flow to the heart muscle is blocked, causing damage or death of heart tissue. Narrowing of arteries that supply the blood to the heart. So if you've already been diagnosed with a coronary artery disease, the goal is to prevent the narrowing of the arteries from causing damage or death of heart tissue. So if you already have the coronary artery disease, we do not want it to cause damage to the heart tissue. And if you have a heart attack, we don't want the damage to the heart tissue to cause death of the heart tissue. Because once it's dead, it's dead. Like, we don't want it to cause irreparable damage to the heart tissue, which is the death of the heart tissue. The last one that I mentioned is the abnormal heart rhythm. Now, the abnormal heart rhythm was just the arrhythmias. I mean, there's a few of them. The most common one that people think of is atrial fibrillation. And that's instead of your heart beating like this and pushing blood out, it just quivers like this. And as you see, if the blood's not pushing out like this and it's quivering, blood is not going out. You have what's another one called SVT, supraventricular tachycardia. So instead of the blood pushing out like this, it's like, I can't even go as fast as it's going. So it's going out too darn fast. It's SVT, supraventricular tachycardia. And then you have atrial fibrillation or AFib. The most common is the AFib, though, the quivering. The problem with that quivering, the blood goes in normally and just shoots out, goes into the heart, and the heart pumps it out, pushes it out. With the quivering, the blood goes in, it quivers, some of it goes out. But instead of it quivering, it stops, goes in there, and it just kind of stays. Blood doesn't like to just sit. If it sits and clots. It causes not the narrowing of the arteries, it just blocks the artery off, which causes lack of blood flow. Lack of oxygen is the most important. It just causes damage again, that same damage to the heart tissue. So arrhythmias cause damage to heart tissue. Heart attacks cause damage to heart tissue. Coronary artery disease causes damage to heart tissue.